Dr. Alison Chiu. I'm a Sydney-based in Australia cataract and refractive surgeon. I'm interested and passionate about improving refractive outcomes and patient satisfaction.
My name is Mun Wai Lee. I'm based in Malaysia. And I'm actually a retinal surgeon, but I do a lot of cataract surgery, complex cataracts, and a lot of refractive cataract surgery as well. And just like Alison, I'm passionate about improving outcomes for our patients in the presbyopic setting.
Premium patient care is becoming increasingly important. You know, patients are better educated. We have better products available on the market, better technologies, and patients' expectations are higher as a result. With Medicontur, we have the complete range of vision options. You know, the material and the design, in my experience compared to using other lens technologies, is really a standout, as well as, you know, of course, the outcomes for patients.
I think the big thing now is the EDOF lens that is really coming to the market, and everyone's having an EDOF lens, and Medicontur has got a very exciting lens now, I think, we both have some experience with. You know, do you like the ELON lens that we're talking about?
Yeah, I love the ELON lens for a couple of reasons. First of all, you know, the platform is great. It's the Medicontur platform with the double C-loop haptics, so very rotationally stable design. That's really important for us, particularly in Australia, because we use a high amount of toric lenses. And it's great that we have now the toric ELON.
I know, waited a long time.
Yeah, we've been waiting for it with great anticipation, and finally it's here, so it's very exciting.
A big thing about these presbyopic IOLs is, you know, there's always a little bit of compromise in terms of quality of vision. I think the EDOF lens has come into the market with trying to find, you know, less of the problems with the dysphotopsias. I think we had, you know, with the trifocals or the glare and the halos.
Yes.
So the ELON has a very interesting non-diffractive platform. I think you mentioned wavefront, so they're wavefront linking and trying to extend the range of vision, extend the depth of focus without actually, you know, creating as much of the dysphotopsias. With the ELON lens, you have that ability to extend the range by just offsetting about half.
Yes,
you do half
just
a diopter,
a small amount.
Small amount.
Yeah.
And you get that reading. I think I've had very positive experiences with that. Well, I've had experience with the ELON lens for, I think, just over 6 months now. I think, you know, you and I have used a lot of these different types of, you know, presbyopic lenses. I think one of the things that we want, especially with toric lenses, is stability. So I think they have these, you know, you can see the image here, these interesting biflex haptics, which are very stable in the eye. And, you know, looking forward to implanting the toric version, because I think that, you know, they probably won't move very much and we get very accurate refractive outcomes. How about yourself? I mean, you know, you use the ELON as well.
Yeah, look, as I said before, we use a lot of torics in Australia, and so the double C-loop haptic design, the rotational stability is second to none. So that's really important for us, and it's really important to really be nailing the refractive outcomes, and that's part of it. But I think for me, that would be one of them, but also the material design. You know, it has a very high Abbey number, so the chromatic aberration is very low, so very high quality vision. And also we obviously have a lot of choices with extended depth of focus lenses these days, but I like the way it's neutrally aspheric, so we don't have to really worry about checking the spherical aberration of the cornea.
I think ELON, we spend a lot of time talking about how great it is. But there's also a very niche market. I think we had a conversation earlier talking about a specific lens that you want to tell us about.
Yeah, so I really like the add-on secondary sulcus lens. It comes in a monofocal, a multifocal, toric and non-toric. And then of course there's the Charioth macular lens for our dry, stable AMD patients with a high NIRAD.
Right.
That's a very niche market. But, you know, in terms of using a secondary sulcus lens like the add-on with excellent rotational stability, we can use it either at the time of the original cataract surgery, so for example to give reversible multifocality with toric secondarily, or, you know, for those strange corneas where the preoperative keratometry just isn't matching up, then we can use the toric lens to refine things post-operatively as a dual procedure.
Well, it sounds like, you know, the add-on has a lot of, you call it a niche market, but it sounds like it's got a lot of applications really, hasn't it?
Yeah, so very easy lens to use, easy to load, very rotationally stable, which I think is one of the really key advantages of that lens.